So the best way to get started there is, and I've written a couple of these articles on my blog on where to start in healthcare when you're brand new, or where to start in health IT when you have maybe a healthcare background but maybe not an IT background. So the answers are a little bit different on both sides, but either way they start like this. There is a lot of volunteer work that is done at hospitals, at clinics, etc. So, go to your local church clinic, go to your local hospital, and look at what volunteer opportunities there are to first and foremost concentrate on the healthcare industry side of the equation. Forget the IT side. The IT side is something you can be taught and learn pretty easily on your own. But the healthcare side and how it works and how insurance works and how to care for patients, what the clinical workflows are, those are actually pretty difficult. So I tell people when you're getting started, just go to your local healthcare institutions, find out every volunteer opportunity you can, whether it's at a nursing home, hospital, clinic, as I've said before. So it's actually not as difficult to get started as it sounds. The biggest misconception I would say is that somehow physicians or the healthcare community doesn't understand technology, or they don't like technology just because they don't use software component A, B, or C. You know what? If I got one doctor's office to do something this way, then it must mean all doctor's offices must do that same thing the same way. And that's not true. Almost every clinical setting that you go into is going to have some variation. It's going to have some peculiarities. Specialties, for example, primary care versus gastroenterology, they're not the same thing. If you're doing dermatology versus heart surgeries, of course, they're going to be different things. So scheduling of appointments, the bringing of a patient into a workflow, whether it's at a hospital or a clinic, the transfer of lab data, these all think like they're generalized. They sound generalized, but they're really not. They're very specialized activities. So the biggest misconception is that technology, the insertion of an electronic health record, will improve things by itself. I think it's going to be a huge impact, starting all the way from employees coming and expecting from their employers, whether it's a hospital or a clinic, to say that they want to be able to use Facebook, or they want to use applications that are friendlier. They want to use their mobile phones to do their and accomplish some of their work tasks. They want to use more friendly tool sets, all the way to actual consumers like patients who are coming in and demanding that they not have to fill out yet another form when they've got data that they just gave to the previous physician. That when they come into an institution, they want to be able to have simple things like Wi-Fi so they can keep their loved ones in communications. I would like to see in the future is a world in which we're not creating a bunch of very deep custom applications and trying to create custom solutions that only a few people know how to run and use and install and deploy. Instead, in the health IT world, along with our partners in the user community, we figure out how to use the vast variety of tools that are available on the internet today, the bring your own device kind of stuff that I just talked about in the previous questions answer, and really look to see how do we start to reuse, redeploy, and customize existing broadly used tools so that we're not always on the back end of the technology cycle.